We are about to have a treat. We are about to listen to the legend, to the bigger-than-life experience, and we are delighted and proud to welcome Professor Hans Rosling, the one and only.
Thank you. Thank you very much for the invitation. I'm going to use this moment to try to convey to you some of the basic facts of the world, not the detail, not the crucial challenges, but how does the world population change? How does aging of the world population occur? What is the health status of the world population? And how much money is there around? Those three things I'm going to talk about. And first, I just want to show you some questions we've been putting. I didn't have my answering device, but this is a crucial question. The United Nations Population Division, they say that there will be 4 billion people more in the world. This is just a normal analog cursor, you know. It's very modern these days. 4 billion more. Will there be 4 billion more? For what reason? All these three alternatives will contribute to more people in the world. But one of the alternatives is the absolute dominant reason for being 4 billion more people in the world. Will there be more and more children, and more of the poor children will survive? Is it the number of kids that is the driver for the increase of the population? Or is it that there will be more adults because the large young generation that exists today will grow up and get older? Or is it because the old people will live longer and longer? People like me will live longer and longer and longer. One of these three is the absolute dominant reason. Which one is it? How many think it's this one? Hands up. How many think it's this one? Hands up. How many think it's this one? Good that you called me to come. This is the normal answer I got in the last question. It's number B. The life expectancy of the world population, what is it today? A newborn in the world today, if everything remains the same throughout the life, how long will an average child in the world live today? 70 years. It is already 70, and we are 7 billion. And if you increase that to 80, there will be 1 billion more. Prolonging life, you have to prolong life to 110 for that to explain the 4 billion. The longer life is not a strong driver of aging of population. It's a completely other mechanism. And I will show you this. This is another one. How many children will there be in the world in the year 2000? We know now that there was 1 billion when I was born, or less than 1 billion when I was born, 1948. Increased to 2 billions. And will it then, what do the UN experts say? Do they say it will continue to increase, it will increase slowly, or the number of children have stopped growing? Well, this is what is the right answer. This is what the Swedes answer. This is what Norwegians answer. This is what the British answer. And this is what United States answer. And if I ask the chimpanzees in the zoo, they will get 33% correct answers. Basic questions like this. We have a maintained ignorance. It's not lack of knowledge, because would it be lack of knowledge, it would be 33% who had the right answer, wouldn't it? Because the chimp doesn't know anything about world population. And yes, by random they would have. So we have ideas and concepts in our head. And I think especially demography. Demography is a deeply mathematical discipline within the Faculty of Social Science. And there are many who link their work to demography, like me. I'm in medical science, but we never learn demography really good, and we don't follow demography. And it's so emotional, birth and death and sex, you know, it's all these fancy stuff that films are made about, you know. And then that's why we have missed it. This is fantastic. This is the biggest event in the history of mankind that ever was completely missed by media. Because it happens so slowly. It happens, you know, from year by year by year by year. Something moving like this will never appear in the evening news, you know. It has to be dramatic things. I have to fall on the stage, be unconscious and carried out. Then it will be in the evening news, But if you move slowly, nothing happens. This is the same with this one. So what I would like to show you here is where the people live in the world first. We divided the world into 4 regions here. Gapminder have done this. Gapminder is our organization, a foundation that provide teaching material for this. We added Turkey and Russia to Europe so that Europe will have any chance at all in this world. We need the Turks and the Russians, otherwise we just forget about it. So we are 7 billion, 1 billion in America, 1 in Europe, 1 in Africa, and 4 in Asia. PIN code of the world, 1114. Up to 2050, there will be no more in Europe, no more in America. There will be 1 billion more in Asia. And then the Asian population will come to an end of fast population growth. It may even have started to decline by then, or it will continue to grow slowly, but the fast growth will be over. Africa will double its population up to 2050. It will be 2 billion. And before the total world population will level off by the end of this century, in the second part of this century, there will be no more in Europe, America, or Asia, but there will be 1 or possibly 2 billion more in Africa. And this is how the world will look like. And if you divide this into east and west there and north and south, you get what used to be called the Old West. It's a very strong identity. A lot of people talk about Western world and Western country, and they never know what they mean. So I strongly advise you never ever to use that term. Say if you mean the rich countries, say the rich countries. If you mean the Western culture, include Russia. If you mean Christian countries, include Latin America. What do you mean when you say things? We talk about the world without having definition. That's fine when we are at the bar or we are at the dinner party, But when you're professionals and when you write theses, you cannot use this sort of terms, So this will be less than 10% of the world population. It's a very important message. And more than 80% of the world population will be living in Africa and Asia. That's the world. And about 3 weeks ago, finally the European Union changed its rule for tourist visa for Africans, enabling Africans to come to Europe as tourists. It was almost impossible before that. The structural racism in the head of the European was that Africans are potential refugees and shouldn't be granted visa. And now an African successful family who want to go with their kids and see Europe, they can come for a month. It's very interesting. We are not prepared for that. I was invited by Nkosazana Dlamini Zuma, the president of the African Union, to lecture in May last year in the African Union in Addis Ababa. And it was the conference of the African women leaders. I was really humbled and embarrassed. There were 3 men invited. I was the only one from Europe. And I really prepared. I did my best, And then I asked her afterward, what do you think about my presentation? Well, the graphics were nice, but you lack all sorts of visions, she said. You're just like the others, she said. What? I said that extreme poverty can be gone in Africa in 20 years from now. Yeah, I know. But that's not where we want to go. That's just the first step. You said that you wanted your grandkids to go on the fast speed railways we are building to come as tourists to Africa. I want my grandkids to go on those railways to be tourists in Europe and go all the way to that ice hotel you have in Sweden. That's what I call a vision. You see, we have difficulties looking in the direction the world is going. And we look at Africa today exactly as we looked at Asia 1960 when they said there would be 1.3 billion people in India. Impossible. Muslims and Hindus, never. That's what was written in media. That's what I heard as a freshman student at this university. We just couldn't grasp it, that would happen. Now, the best real estate in the world is, of course, a beachfront property in Somalia, strandtomt i Somalia. And my dear colleague, associate professor Asli Kulane, that's where she spent her holiday. This is her breakfast table. Wonderful beach in Somalia. You see how difficult we have to look forwards. Key West was built to fight the pirates in the Caribbean. Now we don't remember how ugly the pirates were in the Caribbean. In those films, they've taken away the rapes. Have you noted that? There's no rapes in them. They're sort of nice pirates because they are Western pirates. But these pirates today, they're nasty. So I warn you for this. This is the projection from 1958 when the World United Nations Population Division said we were 3 billion and we are going to be like this, 6.3. And people were laughing at them. And now we know the result. Respect. 4% wrong on a 42 years projection. Demographies are surprisingly correct. Surprisingly correct. They know that parents get a certain number of children on average. Throughout history it was 6. The reason population was not growing was that 4 died before growing up to become parents themselves. Utterly tragic. Sometimes we romanticize about past times. People are even romantic about rainforest. People don't live in ecological balance in rainforest. They die in ecological balance in rainforest. They know a lot about rainforest, and the human rights should be respected. But it's no nice life at all. There are no illegal immigrants in the rainforest. It's an interesting observation, isn't it? I've done research around the rainforest for 20 years, never saw an illegal immigrant. And then people romanticize about it. This is Karl Oskar and Christina. Did they get more kids? No, more survived. It was not that it got worse in Sweden, that 25% left from Minnesota. It was that it got better. And there was no future for that. And then world population increased to 7 billion. And people say that this is an exponential growth. It's not exponential, it's linear. Can you see that it's linear? That's why I use this stick. 50 years we have had linear growth, and it has been called exponential. People don't know the difference between linear and exponential. Here it was exponential, up to 1960. Since then, the growth rate has been falling and falling and falling and falling, and this is what will happen. Not this, because we have reached almost a new balance, and we will go like this. Around 11 billion. We know this. Now, how come that I say the number of children have almost stopped growing now? How come then that there will be 4 billion people more? Where will they come from? Will they come from outer space as immigrants? That would be a real threat for some political parties, if they would come from above, This is the fertility rate. It fell down like this in Europe, number of babies per woman. Like this in America with a baby boom. Asia, high, and then it fell. It's down to 2 now. And Africa, has it started? Yes, it has, and this is what will happen. This is the reason why number of children have stopped growing. And this is the average of the world. So why will then the number of people increase? Well, I will show you first the countries with my dear bubble graph here. Number of babies here, 1 to 8. Length of life, 30 to 80. And you are interested up here. Look, this didn't exist as an average 1964. And then you had one group of countries here, industrialized, one group developing. They had long life and small families. They had short life and large families. And this is what happened when the world changed. Very dramatic change. Look here we go. Can you see how life got longer, and then family planning started in China? They went for small families there, and here Mexico and Brazil doesn't care about the Pope. They use the condoms and they go over to there, and Indonesia is coming here, and this is India, and look at Bangladesh is overtaking India. Pakistan is even following. Look at Ethiopia is there already. Now this is the world today. Completely merged like this, and you see also a longer life. And there's some things which everyone knows. I am surprised. There's one child policy in China. Yeah, but there's 1.66 children born per woman. Conclusion, the Communist Party is not so powerful in the bedroom where children are made. This is the bedroom down here. There's one part of China which is up there, Hong Kong. They have 1 child per woman. How come? How come that we have so very low fertility rate in countries in East Asia that doesn't have one-child policy? Or you see they are urban. No, they are not. South Korea is rural. Taiwan is quite rural. Yeah? Well, I learned this when I was at the bank conference in Hong Kong. Then they said that, we want to work, we don't want to have children, the women said. There's not gender equity in Asia. So we have come to a situation now where the world population, 4 out of 5 people in the world live in societies with 2-child families. And that means that this has happened. The number of children have stopped growing, and what will happen now is that the adult will grow. And the number of children have stopped growing because children are quite healthy. Women have been to school. Almost 80-90% of the young women have been to school in the world today. And the adults will increase. And I will show you here, I have a very specially developed educational tool here, which I will use to show you. Many call them toilet papers. I say that this is 1 billion people. This is 1 billion people. So you have 2 billion below age 15. You have 2 billion 15 to 30. You have 1 billion 30 to 45, 145 to 60, and then my role, 60 years and older. That's me. And the other ones to make more or less a billion. This is, to be a little careful there with them. These 3 are not missing because they have died. Most of them are missing because they were never born. Because way back when I was born, there were much fewer women who gave birth, even if these women gave birth to more children. So what will happen now? Will the world population increase because they will live longer, as most of you thought, or because these 4 will grow up? Let's say you're a specialist. What happens to people like me? Any pathologist here? They die. They die. The rest of you, young and active, you get older. 15 years older, and there is more children. Same amount of children. The old die again, and the rest grow older. And they get their children. And then the old die, and the rest grow older, and they have their children. And whoop, you have 3 billion more people without anyone living longer. Without increasing life expectancy, without having more children, we will still have 3 billion more, just by the big, inevitable fill-up effect. This is the main reason why countries like China, why countries like India will get a higher proportion of old people, will get much more old people. But good news, there will also be a little longer life. And I desperately want to be in this one so I can follow statistics for more years. But this is the proportion. This is, number of children will not increase. You will have a little longer life, but this is a fill-up effect. And this is my main message here today. The countries, the middle-income countries, the best of low-income countries will not get an older population because they will live longer, because they already live quite long. They already live quite long. It's just the fill-up effect that will bring up populations into the old age health problems. We get the detailed map here. This is Europe, 15, 30, 45, 60. See, same in each age group. America, almost the same, lacking 100,000 retired people in South America. This is Africa, very dramatic. 400 million young, almost no old people at all. But, and these are not missing because they died, they were never born. There were very few people in Africa 50 years ago compared to today. This is Asia. A number of children have stopped growing, but they still have this vast area to fill up. It's the fill up of this area that will bring a lot of old people to Asia and increase and multiply the demand for that health service. Not because they will live longer. That will add a little bit to it. Look here. The old die, the rest grow older, and they have their children. The old die, the rest grow older, and they have their children. The old die, the rest grow older, and they have their children. The old die, the rest grow older. And in 2085, it will look like this. You get more kids in Africa, less in Asia, because gender equity doesn't come automatically. You can have economic growth, you can have high education, you can even have democracy. Gender equity is a fight of its own. And women in Asia do not marry. They don't want to have many kids, as long as it's not a decent possibility for them to share professional life with family life. This is fill up of adults. This is the two questions we don't know. End of extreme poverty in Africa, gender equity in Asia, and then longer life up there. This is more or less the population situation. Now, what about health service here? I will go over and show you this, which is a very important one. Here I show money down here, from $300, $3,000, $30,000. And on this axis now, length of life again, 30 years, 50 years, 70 years. 1800, not one single country had more than 40 years in life expectancy, mainly due to horrendous child mortality. But who did best in the last 200 years? Public health or finance? Let's see who won. We won. There's not one single country in the world down here. But there are still many who are poorer than Britain was at that time. The world has stretched out in economy, hasn't brought with it the last ones. But here we have. You can clearly see that we have a group of countries here which still have low life expectancy. Most countries are up here. And they came here in a very peculiar route. Just look at United States and Vietnam. It's very clear if you do this. Whoop. United States got rich first and then life got longer. Vietnam had wise communists for the right period of time. The problem is to get rid of them when you don't want them any longer. Vietnam went almost like this. And here they swapped to market economy, and then they went like this. But today, Vietnam have the same disease panorama and life expectancy as United States had 1980. But they have the same economy as United States had during Lincoln and the Civil War. There's a 120-year discrepancy between where they have reached with disease burden. And here they stand with cardiovascular disease, cancer, neurological diseases, dementia, car accident, psychiatric diseases. Costly diseases to handle, and they are also going into the older age now, and we have a very meager economy. This has never existed in the history of mankind. Population so healthy at such low level, because now they know the importance of breastfeeding. There is tap water, there is industrially produced soap, and there are all these vaccines and drugs and medical technologies that we have. And even more right for women at that economic level than we had at that economic level. This is very tough to be Minister of Health in Vietnam. I have a cancer, I have a stroke, I have Alzheimer. How should they handle them? They have no money. It's extremely dramatic. Extremely dramatic. And the Communist Party of Vietnam can't see anything else than just providing the basic for everyone and let rest be private. Result, those who can pay are almost all on antihypertensive treatment. Those who can pay get cesarean sections. It's very difficult to manage in a society that recently got a good health and new disease panorama, private health service, so it does what it should do. And the rest will die in their cancers. This is very dramatic. Now, what about the very richest countries? How can we do? I will show you finally here the relationship between income, same axis here, just happened to be from 400, 4,000 and 40,000. See, the world is 100-fold difference. 100-fold, 2 zeros difference in money between the poorest and the richest countries. So don't even think industrialized and developing countries. You have to segmentize it in low-income countries, lower middle-income countries, upper middle-income countries, and high-income countries. And Congo here and some other countries, sadly collapsed countries. And there's a line, because here I have government health service, $10, $100, $1,000. Some of us thought that politics were important for this. If you have the money, it's about 10% to health service, or a little more. And here it's almost linear. This means that here we can discuss now, can we afford here everything for everyone? No. I see one head that communicate the sad fact. We still live in Sweden with the concept, the idea that we can provide everyone with everything. But you know where the limit is for human rights in Sweden? It's here. You get titan implant up to there. From there on, you pay yourself. I like when it's clear and sharp cut off. That's what I call the definition. This is human right. It goes here so you can smile and be nice, you know. And my dentist says the other way around. You have to chew here. This should be free, and this you should pay. It's very strange how we do it. Viagra. Yeah, most old people have to pay if they want Viagra. Why? It's really a central human function. But the pressure group is very weak. Has anyone seen mus demonstrating? Män utan stånd. It's a good joke, but you can't even laugh at it because it's so crude. We have a situation where you can't pay for this up here. You have to discuss in this conference mainly how you can cut the cost. And do you know what is most costly with this?
No.
I will not die when I'm 70. I will live to 80, and I require hip replacement, 2 cataract operation, 1 colon cancer surgery, and then dementia care for a very long time. It's very costly to make old people survive. Thank you very much.
I have to ask, though, as you seem to have the solutions, please share some with us. What would you do if you were to decide how to deal with the aging, with the healthy aging, which is our dream?
I don't know. No one has been there before.
No?
The most difficult in the world today is to look at the richest welfare countries. I was called to lecture to the Norwegian government by Jens Stoltenberg. And I said, you have the most difficult task because where you are going, no one has been. Do we really want to put that lot of money in the old people when we have so many youth problems? Is it because there's money in it? Is it really the decision we want to make? Is it medical things we want the old people, or is it social things we would like them to have? How can we model? What is it? It's very difficult. Can we have them to work more, as our Prime Minister wisely said? No, there's no solution. Just don't think that we continue to do what we have done. We have been in a graceful situation for 40 years where the economic growth and the age composition fitted to the technological development. That was just an exception. Most countries in the world, most period, technology development goes ahead of economic growth. I privately wouldn't mind higher taxes. I lectured in the financial sector, and that it's not 1%, it's 0.1% of the people that are getting so much richer by the day. The main problems is countries that have low fertility rate, because they get a high proportion of old people. Like Germany, they will stand on one leg in the future. Germany will stand like this with a lot of old people up here, and that becomes shaky. Sweden stands firmly on 2 legs, and we have fertility rate of 2. And we will then be able to pay. But then we have the problem that so high proportion of the young people don't work, or they don't start to work. The old people will work from 65 to 75, and the young will start working only when they are 28. Someone told me, why don't they start working at 18 as we did? So,
but it's also the Europe, or the Old West, as you describe it. If you talk about the muscular power balance between the unproportional majority there in South and East, what do you expect from Europe's point of view?
United States is quite well off because they have immigration. They have immigration and they have very dynamic, they're very capable immigrants. Japan is worse off because they can't think about immigrants. Sweden also is lucky. The combination of decent gender equity, financing of daycare centers and immigration keeps us in a balanced population situation. We had the Vice Prime Minister of Singapore was in Sweden in October last year for a 1-week visit with 14 highly qualified researchers to answer one question: how do you make children? Because they saw we were so similar in all these ways. You know, we were sort of I had the first lecture. I did like this, I said.
But you could talk about the gender equity, of course, as one of the main explanations.
I go around in the world and brag of the Bishop of Stockholm, who lives in a lesbian marriage with another priest and have a biological son. Beat that.
Thank you. So.